Welcome to the Mamas of It YouTube channel. In this workout, we're gonna break down how you can use internal rotation to help improve your hip function, your glute function, and to help support your pelvic floor, both during pregnancy and beyond. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and mom of 4. And you may have been told that finding hip internal rotation is a game changer for if you're having any hip pain, lower back pain, pelvic floor issues, all of this stuff. And it is incredibly beneficial, but there is a difference between hip internal rotation and pelvic internal rotation. And so we're gonna break down how most of what you may be seeing is hip internal rotation, which is still very beneficial, but how we also need to incorporate pelvic internal rotation to really impact the pelvic floor, and if you are preparing for birth, to help with your birth preparation. So first, what is the difference between the two? Hip internal and external rotation relates to how does the femur move in the hip socket. And these are typically going to be more open chain positions. So how does my leg move on my pelvis? Usually is going to be my foot is off the floor in kind of this open position. Really important as we're like in a swing phase of our stance because our foot is not in contact with the floor. It can be really helpful to find that hip internal and external rotation. Pelvic rotation is just a little bit different because the anchor point is going to be the femur. So pelvic rotation is how does the pelvis move on the femur or on the leg, which is typically going to be more closed chain positions. And so both of them are important and they are related to one another, but the focus is just slightly different. Pelvic rotation is what is going to change the diameters of the pelvis much more, which is more important when we're thinking about pelvic floor function and health, in addition to our birth preparation. So let's break down what does hip internal rotation typically look like and what can we do to help incorporate pelvic internal rotation and to improve your pelvic mobility to support your preparation for birth and just your general hip and pelvic floor function. So typically when it comes to hip internal rotation, you might see exercises like this 90-90 where you're lifting the foot off the floor. So the ankle is moving outwards, which is going to be bringing this hip into more internal rotation. You might be seeing stuff that involves like a mini band around the legs, or maybe we're finding a clamshell where we're finding this foot is coming up. But again, this is an open chain position and it relates to how does my femur move on my pelvis. And you may have even seen some birth preparation exercises where the mini band is around the ankles and then we're finding this external rotation here, or even on your back. So in a supine position, where the feet are moving out. So as you notice with all of those exercises, they were open chain positions. So the anchor point was the pelvis and how does the leg move on the pelvis. Hip internal rotation is still beneficial. I would still incorporate it into my mobility routines. I do incorporate it into my mobility routines. And so it is super helpful to do. But if we're trying to think about how can I create more space within the pelvis, how can I impact pelvic floor function and health, we need to incorporate pelvic rotation, specifically pelvic internal rotation, to help to support how our pelvic floor is able to move and to function. And so now let's break down 5 exercises that you can do to help to improve pelvic internal rotation to help support your pelvic floor and your birth preparation. So pelvic rotation is how does the pelvis move on the femur. And so I want a fixed position for my leg. In this movement, I'm taking a foam roller and I'm pressing it into the inside of my leg. And we can do this on the outside of the leg as well. And so with my foot and knee and hip generally in a stacked position, I have just a slight bend here so this leg isn't super straight and my foot isn't in so much that it's kind of underneath the foam roller. So I want to be in a stacked position. I'm going to press into that foam roller and this is going to help to anchor this leg to keep it from moving around because again, I want this femur to be my anchor point that my pelvis then rotates on. So first I'm going to take that inside hip. So for me is my right hip and I'm going to think to try to bring it towards my left knee. And so this right hip, I'm trying to bring it towards that left knee. Obviously, they're not going to touch one another, but that's the direction that I'm thinking of. In this movement, you should feel like more of a deep stretch, kind of in this hip area, maybe like in a hip pocket. So if you were wearing jeans, where you put your hands, you might feel a big stretch there. You can think like a slight tuck underneath, but the more that I think that this hip is trying to touch that knee, the more I'm gonna feel it back here. I also want you to think about your foot. Again, this whole leg is my anchor. Think about weight is in that big toe. If you start to roll into the outside of that foot, you're not gonna feel it as much. So keep weight in that big toe and then bring those 2 points together. After you feel it, we can then move in and out of it. So we're going to rotate in, rotate out, and just feeling this movement here. Just kind of coming in and out of it. So when you go out of it, you might feel a little bit more of a groin stretch, but when you come in to find that internal pelvic rotation, we're gonna feel that big, deep glute stretch. The next thing that we can do is when we open up, we can step the foot over and come again into that position. So into that hip shift, or I'm thinking that hip is trying to touch that knee, and then step back. So we have some step overs with that foam roller. So the foam roller, again, is just an anchor point that's helping you to keep this leg stationary so that you can anchor off it a little bit better to feel that sensation in that glute. And so when we find that internal pelvic rotation, it creates more space in the lower part of the pelvis, and it helps to stretch the back quadrants of the pelvic floor, which are incredibly beneficial. So if you got like constipation, you got tailbone pain, you got anything in the backside of the pelvis, movements like this are gonna be super helpful. Now, you can also do that on the right side where we face inwards, but sometimes because our pelvis is a little bit asymmetrical, you might wanna try stuff differently on each side, but you can do it on both. So for the other side, maybe I place the foam roller more into the outside of the leg for a little bit more outer glute activation. And then I'm gonna think same thing. I'm trying to bring that hip towards my knee. So I have my anchored leg. I'm gonna think bring that left hip towards that right knee to feel that stretch here. And then I'm gonna press into the foam roller for a little bit more glute activation, which is gonna help to drive this leg just a little bit out of that pocket. Sometimes on the right side, that right anterior pelvic floor is really thick, very active, because we like to put a lot of weight into our right leg. And so when we add that little bit of glute activation, it helps us to release a little bit more when we're internal. And so you can try this on the left side as well, and then we can come in and out of it. So finding that pelvic mobility, how well can we change positions? And then again, you can do this on the left, you can do this on the right, but explore it on both sides. How does it feel for you on this side versus that side? So you can press in with the right leg just to see how that feels for you. You can do your step overs on the right. You can press out on the left leg to see how that feels for you, to explore it. The foam roller is simply helping to anchor the leg so that we can focus on how does the pelvis move on the femur to find that internal pelvic rotation. The next thing that we can do with the foam roller is we can continue to anchor the leg, but now we're gonna come into more of a hip airplane. And we can either do this with the foam roller or we can put our hands into the wall, and I'll show you both variations. So with the hip airplane, I'm gonna think, if you're familiar with yoga, I'm trying to do like a locust pose with my upper body. So that back leg is very active. And I'm gonna think open up towards the wall. And then I'm going to rotate to face the other way. So when I open up towards the wall, I'm gonna feel more of a stretch in the groin area. And then when I rotate to look away from the wall, I'm gonna feel more of a stretch in that glute. Hip airplanes are like one of my favorite pelvic mobility exercises to do if I'm having any pelvic floor discomfort or like SI joint pain, because this kind of helps to lubricate around that SI joint. It helps to improve how well your pelvis changes position. And so this is one of my favorites to do. And then you can try it on the outside of the leg, see if that feels any different for you. So we're just kind of exploring, where do I have my activation? You might be like, no, it feels better for me internal or with the foam roller on the inside of the knee on both sides. But again, we're just exploring what different types of activation feel for us in our bodies. Now I can also take my hands and place it into the wall to use as kind of like my support point if you feel a little unstable with that foam roller, but it's the same thing. I'm thinking this hip is trying to touch that knee, and then I'm opening up. And so that is another exercise that we can do to help to improve pelvic internal rotation and pelvic mobility overall. So how well can you go from internal to external rotation and then back? Now the next movement that we can do for internal pelvic rotation is going to be kind of a staggered stance, RDL, using the wall. Now you could use a foam roller. Mine is like 6 feet long, so I'm gonna use a little Pilates ball that's slightly deflated, but if you had a shorter foam roller, you can totally use that as well. So in this movement, we're gonna find that same kind of shifting within the hips, where I'm trying to bring that hip towards that opposite knee, but we're going to alternate from one side to the other. So I'm gonna put one foot into the wall behind me, and then I'm gonna take that ball and place it between my thighs. And this is just gonna give me some feedback to kind of slide from. So I'm gonna think, drive that elevated knee down. So my right knee is going down as I think right hip to left knee are trying to touch. And then I'm gonna drive that knee straight back. So it's coming straight back into the socket. So driving that knee forward, so feeling more of a stretch in the glute of the standing leg. And then driving that knee back to feel more of a stretch, maybe in the back, the lifted legs glute. And so we're just doing these hip shifts using the ball to kind of roll back and forth. You can try it on the other side. But again, we're thinking about this is the internal pelvic rotation to external pelvic rotation. My anchor point is my right leg here, so my standing leg. And I'm thinking about, how does my pelvis move on this femur? Now, another variation that we can do of it is to have a mini band around the thighs. And so this is gonna have more of that glute activation, which for some of us on the right side is going to feel a little bit better because it's gonna increase glute activation, which for us on the right side sometimes feels a little bit stiffer. So we're still finding that same closed hip position as we lower. And then as we come up, maybe we find a little bit more external rotation with that band. So just a different activation pattern within it. I've been showing both an inner thigh activation and an outer glute activation for all of these exercises so that you can explore it in your body to see what feels better for you on the left versus the right, or maybe what feels better for you on both sides. Now, all of those were mobility exercises. They were, how does the pelvis move on the femur, going into that internal rotation to that external rotation. But we also want to incorporate strength. And this is where you can incorporate pelvic mobility into almost all of your single leg exercises. So whenever I do a lunge, whenever I do an RDL, I can think about, as I lower, that hip is coming towards that opposite knee. So this is internal pelvic rotation at the bottom. And then at the top, I can find more external rotation, or if I'm just doing like a reverse lunge, more of a neutral position. But as I lower, bringing that hip towards that knee, and that knee is gonna stay stacked over that ankle, is gonna help to find more of that internal pelvic rotation. So it's gonna bring more length to that glute, it's gonna bring more length to that posterior pelvic floor, and it's gonna help to improve your range of motion. And so we can do this with weight, either holding the weight on the same side, which is gonna be a little bit more of an external rotation bias as you find internal pelvic rotation. You can do it on the opposite side. But as you lower, we're thinking bring belly towards that thigh. This hip crease here is gonna be driving back to help to find more of that internal pelvic rotation with our single leg exercises. Now, the other thing that we can do is we can add that same activation. So like we did with a foam roller, but we can do it with a band. You can use a foam roller as well. And so this one, I have more activation for that inner thigh. to help kind of increase activation of this adductor muscle here to help keep this leg anchored and stacked. And then I can lower down to find my internal pelvic rotation and then exhale to come up. So I'm thinking weights in that big toe, knees stay stacked, feeling more of a stretch in that hip glute pocket, and then exhale to come up. I can also do this with my lunges. So just increasing inner thigh activation and finding more of that internal pelvic rotation or those closed hip positions at the bottom. And then similar to the foam roller, we can also do it with the outer thigh. So more of that glute activation. So we're here, we're focusing on keeping that knee stacked over the ankle, still weight in that big toe, finding that closed hip position for both our lunges and with more of our RDLs as well. So there's a lot of movements that we can do, your step-ups, your lunges, your single leg RDLs. We can incorporate that internal pelvic rotation to help to improve how well the pelvis moves on the femur, which is gonna have much more of an impact on your pelvic health, pelvic floor function, and your birth preparation. Still incorporate the hip internal rotation. It's great to do, but we can take it a step further with pelvic internal rotation as well. I hope this video was helpful to explain what kind of movements that you can be incorporating into your workout routine to help support that internal pelvic rotation. If you want more of that incorporated into your normal workout routine, check out our online fitness programs. We have our prenatal fitness program, our postpartum fitness program, and our beyond postpartum program for those that are more than 6 months postpartum and not pregnant. All of these are going to incorporate tons of internal pelvic work because we want to help with that internal pelvic rotation, external pelvic rotation to help complement all of the functions of your hip. So your hip can extend, it can flex, it can externally rotate, internally rotate, it can abduct and adduct, and your pelvis can internally rotate and externally rotate. And we incorporate all of that within our fitness programs because we want you to be able to meet the demands of motherhood during pregnancy and beyond. So you can check out all of our fitness programs at mamastayfit.com and use our code YouTube10 to get 10% off any of our online offerings. And if you like this video and you want more like this, or you want me to break down different concepts, comment down below because I would love to help you feel good in your body now and for the years and decades to come.